I'm recording another concept on self. This one is on personality disorders. So an overview, personality disorders are defined as enduring characteristic patterns of thinking, feeling, and behavior that makes an individual unique. There are two important aspects of personality. One is character, which refers to ethical and moral value and judgments. The second is temperament, which refers to innate characteristics like nervousness or sensitivity. Your personality traits are elements that comprise an individual's personality, such as impulsiveness, honesty, openness, agreeableness, conscientiousness, neuroticism, etc. Personality disorders occur when established personality patterns result in repeated conflicts with others and impair their ability to function in society. It is marked by overly rigid and maladaptive behaviors that make it difficult to adapt to social demands and change. Personality disorders are independent of mental disorders and are generally consistent over time and across varying situations. Looking at the pathophysiology, personality disorders typically manifest during adolescence and continue through the lifespan. Personality becomes disordered, patterns are exaggerated, inflexible, and maladaptive. They can exhibit behaviors that include manipulation, narcissism, and impulsiveness. Manipulation is controlling or taking advantage of others. Your narcissism is believing oneself superior and worthy of special treatment. And impulsiveness is acting without regard to potential consequences. They also have lack of insight, fail to accept the consequences of their actions. Some are able to maintain relationships and careers, but others are not. The nature of these dysfunctions is not quite fully understood. The individuals with these personality disorders are often diagnosed with more than one. So there are three common traits with all types of personality disorders. They manage stress by attempting to change the environment rather than themselves. They fail to assume responsibility for the consequences of their actions and illustrate a lack of understanding as to how their behavior affects others. Basically, they just blame everybody else and not themselves. They think everybody else is the problem and not them. So they are egocentric, and so they behave according to the beliefs, desires, and values that occur with the disorder. So basically, they see themselves and their behaviors as normal and view the problems that arise with others as external to themselves, and they often believe that they are being victimized. Diagnostic criteria include impairment in at least two of the following areas: cognition, affect, interpersonal relationships, and impulse control. They can't adapt and they grow more negative, eventually leading them to social isolation. Diagnosis of personality disorders is difficult because there's lots of overlapping between them and lack of precision. So etiology, it is difficult to estimate. Research is difficult, and that's just because of lack of diagnostic uniformity. Most don't enter the healthcare system because they don't think there is a problem. Usually they enter because the family brings them into the system for help, or they are admitted through the court systems, usually by court order. Theories, there are genetics may play a role in personality disorders. Some of their early experiences and family patterns may also play a role. There's no single cause for personality disorders. Genetics, common genetic factor. Some of your predictors are parents that have personality disorders, or there's a family history of personality disorders. Neurobiology, some of your personality disorders of impulse control, they will have high levels of testosterone coupled with low levels of cortisol. This leads to aggressive behaviors that is seen in your antisocial personality disorders. Your borderline personality disorder has activity variations in the brain that control emotional impulses. Your interpersonal factors interact with others in a variety of ways, may project their feelings onto others, have problems developing intimate relationships, may lack a sense of guilt, or may even behave childlessly. Childhood trauma is a key to developing personality disorders. Those with family background of criminality or parental separation, or a childhood that's marked by continually changing caregivers, have an increased development of personality disorders, and sexual trauma also leads to borderline personality disorders. Your social cultural factors, the influence of society and cultural factors is not fully understood, but it is known to contribute to a personal development of personality disorders. Your propensity for specific personality disorders is dependent on social cultural norms. So examples like in Japan, there's a societal pressure to conform and adhere to group norms. In the United States, the emphasis is placed on personal versus communal, leading to a me first kind of mentality. Looking at family theory, many with personality disorders report dysfunctional families, but may also be the result of projecting blame on their parents. Children with certain personality traits like impulsive temperament may be treated badly by parents and peers, or even rejected socially, and this will lead to the development of a personality disorder. Your antisocial personality disorder may be associated with emotional deprivation. Your borderline personality disorder can be linked to family enmeshment and abandonment issues. It is also linked with childhood abuse, which could be emotional, physical, or sexual. And we'll talk about abuse later. Your risk factors, again, as we've said a couple times, family history of personality disorders or mental illness, instability of family life during childhood, or a parental loss through death or divorce can lead to personality disorders. There's a history of abuse, neglect, or other victimization. A client history of other mental illness, such as conduct disorders. Also, low socioeconomic status is a risk factor. Prevention. Personality disorders can be prevented in the developing patterns of behavior, feeling, and thought are identified before they become set, and this is usually during childhood or early adolescence. So if we can intervene at those points, maybe we can prevent these from happening. But a lot of times, nobody knows about them at that time, or it is not brought to the attention of others. Prevention programs will address developmental and environmental risk factors, and to break the cycle of repeating problematic patterns by providing interventions in school and the home to kind of help them through this. Positive role models can help children avoid developing personality disorders, and programs such as like Big Sisters and Big Brothers have been very beneficial. Clinical manifestations. This DSM-5, that is the Diagnostic and Statistical Manual of Mental Disorders, and so 5 is just the 5th edition, and so a lot of times, so every time they come out with a new edition, then that number will change, And then they can also have modifications within the additions, and so that will give you another number as well. But they do a categorical approach, and it specifies that individuals with personality disorders must exhibit dysfunctional behavior towards self and others. They must also maintain a persistent, rigid thoughts and beliefs that are incongruent with social-cultural norms. All right, so in the DSM-5 dimensional model, there are 5 domains of personality characteristics. Antagonism is composed of manipulativeness, which is common use of deception for selfish purposes, deceitfulness, which is lying, callousness, which is no interest in others' suffering or misfortune, aggression and no sense of guilt for negative actions committed against others, hostility, grandiosity, which is feelings of superiority over others, also attention-seeking. Detachment is withdrawal, which is an evasion of social interaction. Intimacy avoidance. They may have anhedonia, an apathetic reaction to pleasant activities. Restricted affectivity, which demonstrates little or no emotion. Your disinhibition is irresponsibility, impulsivity, risk-taking. Negative affectivity. This is anxiousness, emotional liability, mood swings, separation insecurity, which is fear of abandonment. Depressivity, perseveration, which is repetitive behavior that doesn't produce the desired results. Suspiciousness. Your psychotism, they will have eccentricity, which is abnormal, inappropriate conduct. Cognitive and perceptual dysregulation, which is an unconventional way of thinking and doing things. They will also have unusual beliefs and experiences. In the DSM-5, 10 personality disorders are discussed, and they are categorized into 3 major clusters. Cluster A are odd and eccentric behaviors. Your cluster B are dramatic, erratic, and emotional behaviors. And then your cluster C's are avoidant, dependent, or obsessive compulsive behaviors. And so in your book, there's a really good table that talks about all of these on 1856 to 1857. So now we're going to get into the different types of personality disorders. Antisocial personality disorder. This is a pattern of manipulation or violation of rights of others with a disregard for their feelings and or the consequences of their actions. They will have egocentric behavior, which is a pleasure-seeking behavior, also unlawful behaviors. They have lack of empathy or remorse for their wrongdoing. They usually have a risk-taking behavior. 2 traits that are seen in your antisocial personality disorders are antagonism and disinhibition, which we've talked about before. It is seen more in men than women. It is seen a lot in prisons, in substance abuse programs. Usually these people have some type of criminal behavior, and that's why they end up in prison. They also may have symptoms of impulsiveness, dishonesty, aggressiveness, hostility. They can't form intimate relationships. They usually exploit others as a form of interaction. Your avoidant personality disorder is characterized by extreme shyness and fear of rejection. They usually have a great desire to connect and bond with others, but they just can't. Other characteristics are going to be low self-esteem, poor social skills, extreme sensitivity to criticism, unrealistic expectations related to goal achievement. They have detachment and negativity are the two traits that are seen with avoidant personality disorders. They usually have pronounced distrust of individuals, interest in relationship building, and so they just don't trust that they can bond with other people. They have a fear of rejection, or they're usually timid. They have very few close relationships that aren't family members. Your borderline personality disorders, some of your key symptoms are going to be impulsivity, unstable emotions, and depression. Self-harm, such as cutting, is also common in personality disorders. Splitting is inclination to perceive people or situations as one extreme or the other, so everything's all good or it's all bad. And this contributes to their frequent extreme shifts in mood. 75% of those diagnosed with borderline personality disorders are women. They have low self-esteem, intense self-criticism, and disassociation, these are associated with borderline personality disorders. You will also see negative affectivity, disinhibition, and antagonism. Other symptoms that you will see are going to be impulsive, unpredictable, intense anxiety, difficulty controlling their anger. They're usually manipulative, mistrust others. They have an intense fear of abandonment, and they take offense easily. They usually have very unstable relationships with others. Your dependent personality disorder, your central features include pervasive, excessive, and unrealistic need to be cared for. They have difficulty in decision making. They have a separation anxiety, especially from the dominant partner. A lot of times they have depression as well. They have an impaired self-confidence. They're usually passive by nature. They tend to seek out dominant partners who will dictate decisions, decision making, and choices. They usually view themselves as dumb or inadequate. They usually will agree to perform undesirable tasks with goal of receiving praise or acceptance from others. Like I said, they have that intense fear of rejection, and they strive to appear friendly and helpful to others. Your histrionic personality disorder. In these clients, they are self-centered, egocentric, and dramatic. They may behave erratically or act silly in an attempt to get attention. Behind the attention-seeking behavior is a strong sense of inadequacy and helplessness. They are searching for excitement and activity through their behaviors. They usually have difficulty in establishing interpersonal relationships. They may demonstrate highly sexualized behaviors, so they appear provocative and seductive, and this is used to manipulate others. And so acting out may include impulsive sexual encounters and promiscuity, which will lead to increased risk of sexually transmitted infections. They may act out with suicidal behaviors if they need attention and affection is unfilled, and so this is their way of getting attention, and so that people will come and give them attention and affection and feel bad for them. They also can be flamboyant, and they seek to be the center of attention. They usually appear inconsiderate and incapable of empathy towards others. Your narcissist personality disorder. Your key symptoms are a pattern of grandiosity, inability to empathize with others, attention-seeking behaviors. They may also have substance abuse and eating disorders as well as depression. More men than women are diagnosed with narcissist personality disorder. It's usually characterized by an extreme reliance on others' perceptions and or inflated sense of self. They're usually approval-seeking and extremely high or low set of personal standards. Antagonism is one of the traits of this personality disorder. They're usually very competitive, in search of power and fame as well as love. And so they want all of the top things. They're usually very arrogant. They will manipulate others to achieve their own needs. They think that they are better than others. They usually spend a lot of time fantasizing about being powerful, famous, loved, and beautiful. And so these are your cluster A personality disorders, and those are the ones that we just talked about. And so you can see your narcissist, they're on top of the world. It's all about me. Your antisocial behavior. And so basically they are kind of keeping to themselves. They can be destructive and see they're starting a fire to kind of burn things down. Your histrionic, those are the ones that are very sexual provocative. And then your borderline personality disorders as well. And so you can see how some of these can kind of relate to others. And so there's kind of like a little overlap between a lot of their signs and symptoms. So now we're on to obsessive compulsive personality disorder. This is characterized by significant impairments of social functioning and relationships, and an all-consuming desire to achieve perfection in all tasks. They usually have fear and anxiety concerning loss of control. Obsessive compulsive personality disorder is not the same as obsessive compulsive disorder. That is an anxiety disorder, but they do share a lot of traits. In your obsessive compulsive personality disorder, they don't usually see anything dysfunctional about their way of thinking or acting, but in your OCD, your anxiety type disorder, they do recognize that their thoughts are disruptive and not normal. They will identify focuses on career, but relationships are less important than accomplishments at work. Two dominant traits are compulsivity and negative affectivity. Men are usually have more obsessive compulsive personality disorders than women. They lack empathy. They're usually hard workers, high achievers, perfectionists. They're usually inflexible and compulsive. They are engaged in repetitive or realistic checking. They have an extreme fear of making mistakes and tend to be controlling in relationships, which limits intimacy. So these are looking at your cluster C personality disorders. So that's your dependent, avoidant, and obsessive compulsive disorders. And so you can see they've got some of the characteristics here that are listed under each one. Alright, so paranoid personality disorder. They have a mistrust of others, actions of others assumed to be malevolent. So they have little or no motive to do things. Some are suspicious and mistrusting, while others are viewed as deceptive and disloyal. They're usually prejudiced and judgmental. They have rigid and inflexible worldview. They will reject logic or proof that contradicts their own beliefs. So basically, if you try to tell them that this is what's correct, they will basically reject that because that's not the way they believe. They usually have pathologic jealousy that can damage relationships with others. They're usually very argumentative. Your schizoid personality disorder, they generally have detached and aloof social styles, prefer solitary activities, so they like to just kind of be by themselves. They have an absence of humor. They're usually uninterested in forming relationships. They have a wide range of functional abilities. Some live at home independently, while others have to be institutionalized. They're usually disengaged and uninterested in social interaction, so they appear cognitively impaired, even though they're not. They're usually loners. They have a flat affect and prefer social isolation. Your schizotypal personality disorder, they will share similar criteria with schizophrenia patients, but schizophrenia is usually more severe, and we'll talk about schizophrenia later. It is distinguished by an extreme social anxiety and eccentric behavior. Depersonalization is when they feel apart from their body or an overall strangeness related to the physical self. Derealization is a feeling of disconnected from their own body. They may progress to a diagnosis of schizophrenia over time. They usually have trouble estimating their boundaries between self and others. They will have unrealistic and unclear aims. Psychotism is distinguished by eccentricity, cognitive and perceptual dysregulation, and unusual beliefs and experiences. Detachment is characterized by restricted affectivity and withdrawal. And then your negative affectivity is defined by the trait facet of suspiciousness. And those are your three traits that are seen with schizotypical personality disorders. They also usually have bizarre behaviors, appearance, and speech. They usually lack eye contact. They're usually indifferent. They have disordered thoughts. They're usually introverted, and extreme suspiciousness of others. So those are your cluster A personality disorders. So lifespan and cultural considerations. The debate does continue about whether personality, both normal and disordered, can change significantly or is mainly stable across the lifespan. May change some, but is fairly stable process after the age of 30. There are some environmental influence as well as cultural influences. So nurses should first look at cultural influences and not just deem somebody as having a personality trait or behavior as maladaptive or dysfunctional. For an example, those new to the United States may present as paranoid or overly suspicious of others when their behavior may just be a result of being unfamiliar with American cultures. Collaboration. So treatment for personality disorders is challenging. Collaboration with the healthcare team is going to include primary medical provider, a psychiatrist or psychologist, an advanced practice nurse that specializes in mental health, the RN, and then others as well. It's also going to include the client as well as the family members. Diagnostic test. So there's not one test that's used to diagnose personality disorders. So a lot of times they will look at their symptoms, look at the family history, what kind of disorders run in the family, have they had thoughts of violence, suicide, or have they had any self-injury. And so a physical exam. They may do labs to rule out other causes of abnormal behavior that could be from drug and alcohol abuse. So many of these disorders will overlap, making diagnosis difficult. A lot of times they'll use personality inventories in true, false, and yes/no formats. One of them is the personality diagnostic questionnaire. Other inventories use open-ended projective test, and that would be the thematic apperception test. And those are usually how they try to differentiate between personality disorders as well. So your pharmacologic therapy, medications are used to control symptoms. The use of antidepressants, antipsychotics are used to target symptoms. So like with obsessive compulsive, aggressive, and self-destructive behaviors, they may be held in check with the use of SSRIs, which is an antidepressant. Prozac is one that they use a lot. Symptoms with avoidance and borderline disorders may be minimized with the use of antidepressants. Your acute psychosis is treated with your antipsychotics. They may also have other comorbid disorders that need to be addressed as well. Meds are used to complement a comprehensive treatment plan that does include therapy as well. Psychotherapy. Long-term psychotherapy is most highly recommended treatment for those with personality disorders. There are several different types that are used. One is the cognitive behavioral therapy. It focuses on skill training and problem solving. It addresses the symptoms of depression to help the client reframe negative thinking patterns and learn new coping mechanisms. This helps them to identify behaviors that exacerbate their depression so it can be avoided. It is aimed at reducing symptoms using exposure therapy, and so basically they are exposed to are repeatedly exposed to things that cause anxiety, so that hopefully that they will become sort of immune to it, so it causes less symptoms the next time they are exposed to this anxiety thing that usually causes them great distress. Your cognitive behavioral therapy helps with anxiety by providing them with a supportive setting in which they can confront their fears. Your dialectic behavioral therapy refers to striking a balance between two extremes, makes the patient responsible for changing unhealthy patterns. It has been proven treatment for borderline personality disorders. It is also shown to decrease suicidal behavior. It focuses on education so that they can learn to become aware of and explore emotions without reacting to them. They will use behavioral analysis, skills training, and coaching. Your schema-focused therapy is often applied to personality disorders where a patient typically has poor self-image. It aims to help patients view themselves differently so that they can create new and more effective ways of interacting with environment and others. It is extremely effective for the treatment of borderline personality disorders and sometimes leads to a full recovery. But it does combine aspects of cognitive behavioral therapy with other therapies to help change the patient's self-perception. Alright, so psychotherapy. It can use lots of different kinds of therapies together. So group therapy is helpful in strengthening empathetic skills for those with antisocial personality disorders because it allows feedback about perceptions of other group members. One example is called STEPS. It's STEPPS, which is Systems Training for Emotional Predictability and Problem Solving. It consists of 22-hour sessions that that is led by a social worker, and this helps with depression and borderline personality disorders. Your family-focused therapy is useful for family members of patients with personality disorders. It helps them to cope with the stress of living with a loved one with personality disorders and avoid behaviors that may worsen the patient's condition. So basically they figure out what the triggers are that they're doing so that they can not do those anymore. It also teaches them about the disorder and how to improve interactions and support their family members. Expressive therapy relies on creative art such as music and writing to reduce symptoms of depression. Animal therapy brings the patient in contact with animals. This could be dogs, cats, horses, whatever, to work through behaviors and emotional issues. Psychodynamic therapy provides greater self-awareness by exploring how the subconscious motivation and feelings can drive behavior. This therapy is usually used in combination with others like your cognitive behavioral therapy. Your complementary and alternative therapy. There's no specific alternative therapies for personality disorders, but some of your CAM therapies help provide relief from some certain symptoms. For like anxiety, the use of chamomile tea, yoga, meditation, and breathing exercise help those with anxiety to relax. Concomitant depression, the use of vitamin B12, omega-3 fatty acids can be used to help ease depression. Omega-3 fatty acids also help prevent psychosis from fully emerging in young people who show signs of developing the disorder. Nursing process. Primary goals are going to be to identify behaviors, beliefs, and thought processes that are disruptive of the client's social, professional, and personal life. The symptoms may make it difficult to develop a nurse-client relationship, especially when the patient denies the presence of these symptoms or even that there is a problem at all. So looking at assessment, data collection is done by interviewing family members, but it's also important to protect clients' rights, just remembering patient confidentiality. The client may deny the problem exists. Also get a nursing history, so you want to assess their work history, any history of behavioral problems including violence towards their self or others, history of any suicidal ideations, and then what are their usual methods of resolving conflict. You also want to look at their alcohol and drug history, the nature of their relationships with family members, co-workers, and friends. You want to ask questions that encourage self-description. In the physical exam, signs of self-directed violence, so you're looking at have they cut themselves, have they done other things to themselves, burn themselves with cigarettes. You also want to assess for evidence of any alcohol or drug use. These are your NANDA diagnosis for personality disorders. And there's the rest of them. Alright, in planning, goals may include that the client will remain free from injury, they will refrain from violent behaviors, they will report a reduction in their anxiety levels, they will adhere to established rules and guidelines that have been preset for them, they will verbalize their emotions to the staff, and they will actively participate in one-on-one and or group therapy sessions as directed. So looking at implementation and promoting safety, priorities of care include injury prevention and safety promotion. Heightened levels of injury prevention are going to be needed for those who are self-destructive or who have impulsive behaviors. And so those are the ones that do those risk taking behaviors that could potentially cause injury to themselves or others. Use of behavioral contracts to outline the prohibited action, the consequences of their actions, and to establish clear guidelines and expectations for them to follow. Ensuring a safe client environment, so making sure that there's nothing in the environment that they could hurt themselves with. So a lot of that is just making sure that you take things out of their rooms and stuff that they could potentially harm themselves with. So basically you're just helping them to keep those self-destructive behaviors to a minimum by removing things that may influence those actions. You also want to monitor your clients' activities and encourage them to seek help from the healthcare team when the client needs to process their feelings. So like basically when their stress levels are starting to rise and they're starting to feel out of control. Promoting therapeutic relationships, ineffective social skills, and impaired perceptions creates unique challenges in establishing their therapeutic relationships between the client and the nurse. Unplanned admissions to the hospital or treatment center creates anxiety and mistrust, so it's kind of hard to get that trust back. You want to be consistent with client care, so a lot of times they'll have the same nurse taking care of the client and try to keep them a good pattern going on, and make sure that you're respecting the client at all times. You want to establish boundaries. And so basically what is acceptable to the individual in all aspects of life. The nurse-client relationship needs to establish and maintain healthy boundaries. So you want to establish a sense of safety and predictability for your patient. Teach the client about healthy boundaries and how to understand them and set them. If faced with potential boundary violations, you want to assess the client's coping skills and teach them about healthy responses to boundary violations. You also want to teach that the client has a choice in how they react to things, and you want to help them set and maintain those boundaries. And be alert for exploitive behaviors. When you're doing your establishing boundaries, anytime you have a breach of boundary, that occurs when the limitations are either ignored or they're exceeded. And so those are the limitations that were set. All right, so evaluation. Your expected outcomes may include that they remain free from injury, they don't demonstrate violent behaviors towards themselves or others, they will verbalize understanding of the concept of boundaries that have been set for them. They will verbalize understanding of the principles of respecting boundaries related to themselves as well as others. And they will actively participate in individual and or group therapy as directed. So this is the conclusion of the personality disorders. And as always, if there's any questions, please let me know and I'll try to help clarify.